Okay, we'll go ahead and get started. I am Emmy Henley, the Managing Director of the Reform Alliance. We appreciate you guys joining us tonight. For those of you who have already joined us, I wanted to let you know that there's a Q&A button at the bottom of your screen, and we would love for you to submit questions to our panelists. You can do this at any time, and we will have an opportunity to address those questions toward the end. We appreciate our panelists joining us tonight to review some of the educator-related resources and information they have for the foster care, mental health, and military communities. We are holding this event tonight because May is a month of awareness for all of these communities, so we are here to celebrate you and bring awareness. Joining us tonight, we have Tiffany Wright, who is the Director of the Division of Children and Family Services, the Arkansas Department of Human Services. And then we have Dr. Betsy Kindall, who is with Arkansas Aware, the state project coordinator, which is a part of the Division of Elementary and Secondary Education. And then we also have Colonel Don Barry, who is retired from the U.S. Air Force, and he is part of the Military Officers Association of America, Central Arkansas. So before we get started with our guests, we wanted to do a brief overview of the new scholarship program, the Arkansas Children's Educational Freedom Account that was created by the LEARNS Act. So foster and former foster children, as well as children of active duty military members, are among those eligible to participate in the first year. And we will add the link to our website in the chat where you can find the full list of all students who are eligible. For those of you who maybe haven't heard of the EFA program, it allows parents to access funds that can be used for your child's education, including tuition at a private school. You can find more information about that on our website, along with links to more resources and presentations on the EFA program, and you can also subscribe to our newsletter on the website to stay updated. Okay, let's see. Now that everyone has had a chance to join us, I'd like to remind you that you can submit questions using the Q&A button at the bottom of your screen, and I would like to turn it over to our first guest, Tiffany Wright.
Hey, thank you so much, Emmy, and thank you for the opportunity to join in, and glad we have some guests joining us. So like Emmy said, I am Tiffany Wright. I am the Division of Children and Family Services Director on day 4. So brand new in this position this week, but I've been with DCFS for 14 years before that. But grateful for the opportunity. I love talking about DCFS and the work that we're doing over here. So I think Spencer's or someone's going to share my PowerPoint tonight. And then I will just move through the PowerPoint. Obviously, ability to answer questions as we go along. I'll be here until we're done. So I'll go ahead and get us started if we're ready to share. Okay. Y'all do a great job making technology work like it needs to. I did not want to do this myself. Okay, so on the next slide, I just wanted to share a little bit about our values. I think it's important that everybody knows what our values are. So we believe at DCFS that every child deserves a safe, stable family every day, and family may be different for every child that we're serving that touches our system. Our priorities are safely stabilize and preserve families, reunify children to their families of origin, and safely create new permanent families for children. And we recently at the division in September, late September, early October, rolled out a new practice model at one table that really provides our staff with an in-depth look at everybody's responsibility at DCFS's values and expectations that we set when we're working with children and families. If you want to go to the next slide. And so while we're talking about values, I also think it's important for everybody just to have some quick working knowledge about DCFS. We're a big organization. We have a lot of moving parts, complicated at times. And so I just wanted to share some data points with you all tonight about DCFS. So we actually in our state fiscal year 22 from our DCFS annual report card, and all of this information is online on the Arkansas Department of Human Services website that we can share. We investigated 25,563 child maltreatment reports, and we actually served last year more children and youth in their home with their parents, providing services and support than we do typically in foster care. So right now in foster care, we have approximately 4,100 children, and we work every day to diligently ensure that those children and youth are placed with their family members or fictive kin, and teachers are considered fictive kin. So if you are a teacher on here tonight and you work closely with a child in your classroom that is unsafe and is removed and put in foster care, you can actually be considered as fictive kin and be a placement option for that child, which is a great opportunity for both the child, but also the division, because we get to keep them in their school and in their community and with someone that they know. So we can talk more about that, or I can answer questions about that if you would like me to. We have approximately 1,500 foster homes in the state serving children and youth in foster care. And then I thought I would go ahead and just share a little chart that shows the discharge reasons and where children return back to when they exit foster care. Next slide. Okay, so obviously we're talking about education tonight, foster kids and education. And so I just wanted to share some statistics about foster kids compared to their peers who are not in foster care. And I'm not going to read all of these to you. We can make PowerPoint available, but the big ones are, look at the graduation rate, 50% graduation rate. They're typically behind in their credits. More than likely to be absent or suspended, 3 times more likely to be expelled. And obviously the one that is big down here at the bottom, the last bullet point, 56 to 75% change schools when they enter into foster care, which is something that we work diligently to prevent, but sometimes we can't. And that's a sad reality of our system. That we want to work and collaborate with people like Arkansas Reform Alliance on when we talk about schooling. So together, we can ensure educational stability for kids in foster care. And we do this at the division, and the first bullet point is a priority. How do we keep them in their school of origin if and when they have to enter into foster care? And what does that take, and what does that look like, and what are those logistics? But we work at removal to do our very best to keep those children and youth in their community. Also work to make sure we have a true, accurate standing of their educational or academic and behavioral information, so that we can strategically make sure that we are addressing their needs if they have to change schools, and make sure that's the most stable. So thinking about things like their IEP or 504, how do we bring that along with them and make sure that they continue those services? And obviously continuing to try to be proactive and involved in their education as their time in foster care goes on, if they're not, depending on what reunification looks like or their permanency plan changes. You want to go to the next slide? So I talked a little bit about schooling options, and I said several times, the priority is to keep them in their school of origin, but we also have a policy that says that all children shall attend in public schools. And so we want our kids to remain in public school, but we do have exceptions. And the DCFS director can grant an educational waiver that allows a child to attend a non-public school or a private school or homeschool if we believe that that's in the child's best interest. And when we do those, so we have an educational specialist here in our main office, and that works with the staff all across the state on this topic. But we do ask some hard questions. We like to dig in, know who the child is. Why do we believe this is in their best interest? What is their permanency option? Because we don't have a funding, we don't have a way to make payment for those children to attend private school, for example. And so what does that look like long term? If their goal is reunification, and what would that look like for the parents, or if we're reunifying with grandparents, or maybe we're looking at family members out of state. There's a whole lot of factors that go into that decision making. And so obviously we take each of those on a case by case, and the DCFS director can approve a waiver criteria for them to not attend public school. But we do encourage this because many of them do have the 504 plans or need that special education or the additional supports from the school district. And so we do our best to try to keep them enrolled in public school setting. And then obviously if they're have a medical condition and they can't be enrolled in public school, we do a waiver process for that as well. Next slide. Okay, so we are actually running what we're calling an educational pilot. So we have picked we've picked 3 different parts of our state, Sebastian County, the upper half of DCFS service area 10. I should have included a map. I'm very sorry. But this would be the Delta, the top region of what we call the Delta. And then the smaller counties of DCFS service area 8, Fulton, Izard, Sharp, Randolph, Lawrence, and Clay. And we have a person, we're working on hiring a person. We have some onboarded, but we're working on additional. And their sole and main function is going to be to know the kids in those counties' educational needs, but also build strong collaborative relationships with the schools, and making sure that we are making every best effort to advocate and ensure that our kiddos have their educational needs met. And so I just took like 5 of the bullets of what their example job duties would be. But this is something new that we're trying with the support of our statewide education specialist to see how this works, and can we replicate this in other parts of the state. So we picked some of our smallest counties, some of our harder counties with resources, and then a bigger county that could really be busy and impactful. And how do we manage the workflow? You want to go to the next slide? So I made up some of my own frequently asked questions, but if there's others, obviously, what does it take to enroll a child into private school? We just talked about that. It does take DCFS director approval on a case-by-case decision-making process, but for that child, with that child's also that child's entire team. So when children come into foster care, they have an attorney ad litem, they have a CASA worker, the parents have attorneys, there's a judge assigned to the case. And so we try to engage that entire team to make sure that we're making the very best decision for that child and for that family. We don't cover the cost of tuition, but again, like Emmy said at the beginning, we have the EFAs. And so eventually, looking forward to how that will impact foster kids and how we'll be able to leverage some of that as we move forward. And we also commonly get questions about extracurricular activities. So yes, DCFS does cover extracurricular activities. We want our kids to be involved in extracurricular activities, whether that's I put in a private school, but that would be in any school. We want them to have, if they're in foster care, the most normal life that they can have, that we can give them. So we do cover extracurricular activities. Now I will say to an extent, because we can't pay for every child in foster care to go on that $3,000 school trip, and we can't pay, so we have to assess and make the best decisions for all kids in foster care when we're making those decisions. And then the last question, what kind of impact do you think the LEARNS Act will have on current and former foster kids? Well, we know that both the current and former foster kids will be able to benefit from it. And so we're looking forward to this progressing forward and learning how foster kids can get some of the benefits and the services, and obviously a strong education through this. I think I have one more slide maybe. Okay, so I know that there's question and answer, but important for you to know, some other people at DCFS that can be a support if there are further questions. So Sherry Rogers is our educational specialist. Her supervisor is Assistant Director Kristen Harper. And then I gave my information as well. And again, we can share all this contact information with you. Next slide. Okay, so I have to put this in here because it would be crazy if I got onto a Zoom call and didn't talk about recruitment for foster parents and volunteers. So we've launched in February, Every Child Arkansas, and this is our new recruitment effort to recruit more resource parents for children in foster care. They have a website, Every Child Arkansas, and I'm just encouraging people to go out and visit the website, even if you're not interested in being a foster parent or an adoptive parent. You can figure out how to engage, do volunteer activities, see what's going on out there, see what's happening in your county, wherever you might be listening from across the state. Sorry, Emmy, I just had to get that plug in there. You know, we need more foster parents, so it's important to me.
We are not against that at all. We encourage definitely plugging in where you can.
Okay, and that's all I have.
Thank you so much. We appreciate that. I cannot wait to see like more information on the educational pilot that you talked about. And of course, working together to be able to access options for foster kids and former foster kids that need that through the EFA program for sure.
Us too, definitely. So thank you.
Yes, of course. Okay, and now we will welcome Dr. Betsy Kindall.
Hi, how is everybody tonight? Thank you for inviting me. I think this is the second time I've spoken on for the Reform Alliance, so I'm happy to be back. You can pull up my slides, and as you're doing that, I really kind of scoured through to determine, okay, if I were watching tonight, what would I want to know? So that's kind of what I've offered up to you guys, is a lot of resources. So a brief picture, I work for the Department of Education, and I oversee a $9 million federally funded project called Arkansas Aware. I am an educator by trade, a licensed school counselor, and for many years, I worked as the school-based mental health coordinator for the department. So what I did was work with agencies across our state and school districts across our state to make sure that their partnership was high quality and effective in making sure that our students have the mental health supports they need so they can be healthy and function to their top ability within the classroom. So to kind of give you an idea before we go through the slides about what's happening in Arkansas, and you say, okay, well, why school? Why are we talking about school-based services? So we have about 30,000 kids across Arkansas getting mental health services, and most of the time, those services happen at school. And so we work with school districts to make sure that they have a confidential space, and they have policies in place to not only support the students as they get those services, but also to offer safeguards there to make sure that people are appropriately licensed, because while the student is at school, it's really the school district's responsibility to offer that kind of protection and be that role. And so lots of times I get that question, why at school? That's because that's where the kids are and we have to meet them where they are. I get lots of questions too. So if you look across the state of Arkansas, about 90% of our school districts that have, and nearly a huge portion of our districts have some sort of professional mental health service available to our kids. So most of them do that through a contract or with a partnership with an agency like Families Inc. or Arisa Health or Chenal Family Therapy. I'm just naming a few that come to mind. But we do have some school districts across the state that also employ their own clinicians. So if you're a parent listening, your child may go to a school that has their own clinicians employed at the school district. However, even if they're employed at the school district, more times than not, they also have a partnership with an agency to provide higher levels of care, and that's definitely needed. So one of the questions I get a lot is, okay, if I'm a parent and I feel like my student is in need of mental health services, what can I do at the school level? And I'm going to talk to you about some other resources that are out there here in just a minute. But at the school level, the first thing I always tell folks is talk to your school counselor. Our school counselor and our school nurses are the point of contact and the point of entry to get all of our students on a path to a greater level of service. So when teachers recognize students are in need of services, that's where they go. They go to the school counselor or school nurse, a referral is made, they'll reach out to the parent, and that process usually goes that way. There's a lot of other scenarios, but that is typically, how that rolls. So let me tell you a little bit about Aware and the resources, and then I'll answer any questions you have. But Arkansas Aware is a $9 million project that is built around educating Arkansans about the importance of mental health in schools and mental health awareness and education. So there's two aspects of that. We actually have 2 Aware grants currently, and I'm only going to talk about the first one, our current one. We have a site, so we do a best practice site. That site will have mental health services and an array of support services. But tonight, I'm going to talk about the other piece of that project, and that is a statewide training model that anybody can tap into to educate yourself, or educate, if you're a teacher listening, educate yourself as a teacher, as a parent, but also any staff that you have about how to identify the needs in our kids and how to get them help, but also how to identify the needs in ourselves and make sure that we take care of ourselves as well. So how do we do that? And I'll let you go to the next slide, Emmy. One of the biggest thing that Arkansas Aware does is we provide training statewide. We have a statewide training team that they're located all around the state, and we do a lot of work virtually as well. These trainings that I'm going to talk about, they're for everyone, whether you're a parent, an educator, an administrator, a community member. Anybody can plug into these. However, our priority is our educators to make sure that they get trained. But Youth Mental Health First Aid is for anybody and everybody. And that's the one I'm going to talk about the most, because you guys probably noticed, or if you didn't, in the LEARNS Act, mental health training is required. And I know that the department is looking to develop a training around that. However, we also have Youth Mental Health First Aid currently available. Youth Mental Health First Aid is an amazing opportunity to plug in to, most of the time, this is kind of what I say all the time if you've heard me talk. Most of the time, if somebody's in front of you and they're going into cardiac arrest, if you don't know CPR or if you don't know what to do, you at least know to pick up the phone and call 911. Do you know what to do if somebody's in front of you having a panic attack? Because the likelihood of that is much greater in today's time. And if the answer is no, if somebody's in front of me having a panic attack, I don't know what to do, then I think you might want to check out Youth Mental Health First Aid. And Youth Mental Health First Aid, particularly the youth piece, is for anybody working with kids ages 12 to 18. It's not just for teachers or parents, but anybody that works with the kids within that age population. It can be for bus drivers. It can be for people like Tiffany talked about, staffers in the foster care system that work with these kids on a regular basis. And Youth Mental Health First Aid is not only it's a 6 to 8 hour training on how to have some of those hard conversations if somebody is in distress, or how to identify if they are in distress and what you do in that case. It's really about how to have those really hard conversations. Youth Mental Health First Aid does not make you a clinician, and it does not make you a counselor. But I say that because the bottom line is we're trying to fill your toolbox with these skills on tools on how to help our kids. And Youth Mental Health First Aid, it is not a be all and end all, but it is a really good first step on educating ourselves on how to do that. Another really great thing about Youth Mental Health First Aid is that it also helps us recognize when we may need a little bit of help ourselves. A few years ago, we started training our teachers on trauma-invested classrooms, and that's some of the trainings in addition to all of these listed up here. We do all of these trainings for our educators. And we had to realize that, we need to do some staff wellness and really hone in on, are our educators okay? because unregulated adults cannot regulate a classroom of unregulated students. And as parents, it's really hard to take care of our kids who are not well if we are not well ourselves. And so if you hear anything I say tonight, it's first and foremost, take care of yourself. So, it's like being on the airplane that's going to crash. You notice that the instructions say you put the oxygen mask on first before you put it on your child. And it's the same way in mental health. So if you're interested in any of these trainings, whether you're a parent or an educator or a community member, if you go to the next slide, there's a QR code. All of these trainings are free. And if you click on that and hit Youth Mental Health First Aid, it will show you over 40 trainings, certification trainings that are all around the state this summer. And some of those are virtual also. So if you can't get out or you feel like you just want to do the virtual portion, you're welcome to do that. And most of them, or nearly all of them, are free. Some of them are educational service co-ops, and if they do charge a small fee, it's typically to assist in paying for lunch or something like that. Also, if you're listening and you're a parent, community member, or educator, and you think, okay, well, this is great, but I want to do it for my staff, or I want to do it just for my community members, there's a button at the bottom that says request training. And that will take you to a Google Doc or a Google Sheet that you can fill out, and it comes to our services coordinator, and we can customize training for your staff or your location. So that's a really great resource out there for anybody and everybody if you really want to know more about recognizing what's going on with yourself or others when it comes to mental health. All right, Amy, the next slide. So the next few slides, I have a ton of different resources I'm going to talk about pretty quickly, and then I'll answer some questions. I just want to make sure that you have everything that you need. And I know in the recording, you can go back and get this information because there's a lot of really detailed information in here that you're going to want. Okay, Emmy. So the first one is AR Connect, and AR Connect is a 24/7 availability for behavioral health services. You do not need a referral and no health insurance is required. There's no payment required outside of what insurance pays, and they will connect you with a mental health provider, and they will also have clinicians who staff that line. So if you're out there and you're thinking, you know what, I really need to talk to somebody, this is a really great avenue to help connect you with somebody locally, or to connect somebody if you want to do a telehealth visit or something like that. This is a really great opportunity to get availability of services there. Okay, the next slide is particularly about, at the Department of Education, I always put this slide in because it's super handy for military families and veterans. We have a liaison, his name is John Kaminar, and he's fantastic. So if you are a military family, or you are an educator with a military, have a student that needs some type of services, we have a liaison that you can connect to, and his name is John Kaminar. So his email is there. So any kind of service that you need, we have available through his office, which is a really great resource as well. Okay, we also, the next slide is NAMI Arkansas, or NAMI Arkansas, and they do a lot of education around mental health. So if you're a community member or an educator listening, check out NAMI, because they do a really great job of offering some professional development, but a whole lot of other services around awareness about mental health that focuses on reducing the stigma, because Arkansas is a rural state, and we have a lot of families and folks who just, there's still a lot of stigma that's related to getting mental health services. But the bottom line is there's a time where we all need a little bit of help and a little bit of support. And they do a really great job of offering education around that. So if that's something you're interested in, you could also check that out as well. Okay, so the next slide, Emmy, this particular slide is for our educators that are listening. And I don't think a lot of people know about this, but I really want you to hear me out. For our educators listening through your employee assistance program, there is free counseling services for you and anybody in your household. Anybody in your household under the age of 26 can get free counseling and therapeutic services through your EAP by calling this number. You do not have to have the school district employed health insurance. It doesn't matter. It doesn't matter what insurance you have, but it's absolutely free. There's no deductible, no copay. You can do it in person, online, over the telephone, or via text, but you can call this number and get that set up. So again, if you're out there and you're an educator and you're thinking, I really need to just talk to somebody, or I need to connect to somebody, or somebody in your household needs to connect, through your EAP, this is totally free of charge. So you can take this 1-800 number and keep it handy and utilize this resource because it's out there for you. So I know I talked really fast. I don't want to take up any more time than absolutely possible, but those are a ton of resources that are currently available for you. But again, if this is my contact information, but the bottom line is, if you've heard anything I've said tonight, it's first and foremost, take care of yourself first, so we can take care of our kids in our schools, and so they can perform at their highest level within those classrooms, but ultimately, so they can be good citizens of the world. And so as educators and parents, we want to nurture them, and hopefully some of these resources will help you do that. The second thing I want you to hear after everything I've talked about today is talk about mental health. We live in a state where the stigma is still very real. And talking about it is the first step to really opening up those doors of conversation. And if you're not sure about how to do that, check out a youth mental health first aid course or a mental health first aid course. If you have trouble navigating our website, email me and I'll help kind of set you up, plug in and educate yourself, because the more we know, the better we do. So if there's any questions, I'd be happy to answer them, but thank you for having me tonight.
Thank you so much. And yes, we will share all of those resources along with your contact information in an email that goes out to all of the attendees and everyone that registered, so that we can share that, because I had no idea that there was all of that available. And the free counseling for teachers is amazing. I had never heard about that, and we've been doing this for a minute. So okay, I wanted to remind everyone that there's the Q&A button at the bottom. So if you do have questions, just submit them there, and then we will probably tackle all of those at the end. And then we will move on to Colonel Barry.
Hey, thank you very much. I very much appreciate it. Reform Alliance has been just so powerful in working on behalf of all Arkansans, but especially we would like to say for military families has been very beneficial. We talk about the challenges that families encounter because of school, because of PCS moves between assignments. Families will oftentimes see as many as 5 or 6 moves during a child's K through 12 venture. So it's very, very important. The school transitions and the work that Department of Ed, as well as our efforts with the Reform Alliance, have really landed us in a great place in Arkansas. I want to talk really first about the Arkansas Military Child School Transition Act. Dr. Kindall talked very much about how one element within DESE is very much focused on this, and we really do appreciate the work that Mr. Kamenar and the staff are doing on behalf of our military families. The Arkansas Military Child School Transition Act was initially enacted in 2019 legislative session, and then amended in 2021, expanded, and it runs in parallel to what you might remember is the Nationals, the Military Interstate Compact for Children. What we effectively did for Arkansas is we replicated the compact's provisions and extended them, because the compact wasn't able to go beyond its structured. And we were able to add such provisions as advanced enrollment, allows a family, as soon as they get their assignment notification, perhaps in as early as January, to be able to reach out to a school district that they're intending to enroll their children at, and actually do on the same timeline that families who are here, they're able to get their children involved in extracurricular activities, get those enrollments done early enough, register for coursework that gives military families the opportunity to have the same priority for access to advanced placement courses, special ed environment programs, and volleyball teams and softball teams, and being able to be part. Our recognition is that our extracurricular activities are as much as 50% or more of what is healthy for a school, for a child, and to be able to transition from school to school. So the Arkansas Military Military School Transition Act, advanced enrollment, I've talked about virtual enrollment. So especially key for someone who's an entering senior, making sure that in that dialogue with that incoming school district, making sure that the school records and their curriculum to this point in time matches what their graduation requirements are going to be in Arkansas. So military families have the opportunity, even before they arrive, those children may enroll in a virtual coursework to be able to align those so that they're on pace with their peers when they arrive in Arkansas, so that they don't stand out and they're able to walk through the graduation line on time, just with their peers. Key to that orientation as to who they're talking to at the school district. Any school district with 20 or more military connected children, that's active duty, guard, or reserve, more than 20 military connected children, or a school district that has more than 3,000 enrollment, is required to have a school transition plan in place for the military kids. Now, school districts can actually use this for anyone who's transitioning in, but that plan is required for any one of those school districts. To this point in time, the Purple Star School District is that's the means by which districts are able to establish these programs. To this point in time, when we implemented the program in 2019, it was signed in April, and before the law even went into effect in July, we had over 45 public school district military education coordinators. This is a coordinator that's in every one of these districts to be able to take those phone calls. They receive the trainings. John Kamenar and the team at DESE do trainings with the school districts throughout the year, and bringing on more DMICs, is what we call them, to be able to do that coordination process. Purple Star Schools, which is the program to which that school district is attached to, we have 116 Purple Star schools in Arkansas. We were the third state in the country to adopt the Purple Star School program. Ohio originated it, and then to Virginia. Arkansas was the third state in the country to adopt the Purple Star School program, which is the means by which to provide a transition support. Many of it are based upon the students in the school run the program. And so they're part of that recognition to be able to welcome a new student coming into their district. But as I said, 116 schools in the state have adopted, are recognized as Purple Star schools. 14 school districts as well. Entire school districts are now Purple Star districts. So that's very, very important. As we go through the process during that transition, I'd make sure that if folks are talking to the Little Rock Air Force Base School Liaison, has a footprint that's across the entire state and deals with not just Air Force families, but I'll put all of that information in the material that we provide to the Reform Alliance so that you can have that following on. But it's really key is to be able to recognize that that we have a program, a structure in place. The trainings are there for the districts. Arkansas's districts have been just fantastic in their adoption of these programs and the outreach that our family, the feedback, and we'd like to hear more from the families as to what they saw and how that journey went for them. I talked about this first before I talked about something that's probably the most significant piece of legislation that I've experienced in the time that I've worked on behalf of military families here in Arkansas. Certainly the LEARNS Act did special things with all of the components. The elimination of the 3% transfer cap from public school to public school transfer was significant, but it left in place the 1 May deadline. Well, I just talked about how advanced enrollment works and how you are able to work with a district in January. Well, what happens when you arrive here and you can't find suitable or affordable housing in the district where you've done all this planning? So you end up finding residents elsewhere, but you're now here after the 1 May deadline. So you don't have an opportunity to transfer your child to that district that you've been working towards. So all of that planning is for naught. Well, Senate Bill 458 as Act 649, effectively all it did as a technical bill is it eliminated the 1 May deadline for active duty families coming into Arkansas. It also eliminated it for children of surviving spouses, for guardsmen or reservists, 180 days prior to or 180 days after a deployment. And it also eliminated it for people coming off of their terminal assignment. So we had, in this case, we had Little Rock Air Force Base families spread out from Bald Knob all the way to Sheridan, from Lonoke to Conway, and so many different school situations where they weren't able to transfer to where they were going to eventually be housed during the rest of their perhaps a 3-year assignment at Little Rock. So they were forced into 2 transitions. So what that one little piece of bill was by eliminating one sentence in the Choice Act of 2015, combined with the LEARNS Act, we now have, in the case in Arkansas, is that an active duty, the child of an active duty family can attend the public school of their choice, regardless of where they live. We are the 9th state in the country to enact that provision, and it's one that is probably more beneficial to active duty families, making that separation between the residence that they're going to be just temporarily living in and where their children attend school. Gives some great opportunities there. And again, it goes back to the work of Reform Alliance and certainly Governor Sanders and initiatives. She signed, ceremoniously signed SB 458 into law in a ceremony at Little Rock Air Force Base on the 9th of May, long after the bill was actually enacted, but great support there at the University Center at Little Rock Air Force Base, which is also my third topic. I want to talk about Starbase, and I'll provide some information here. Also in the University Center there at just outside of Little Rock Air Force Base is Starbase. Starbase is a DoD program across the entire country where the military actually stands up STEM operations within a classroom for 5th graders. 5th graders within classrooms within an hour of Little Rock Air Force Base spend 5 days at Little Rock Air Force Base in that classroom working STEM projects. They're on a mission. They're given a call sign. They're given all sorts of details, so as if they are on a mission and they're going to use STEM to solve projects that they have during that week. Other coursework is provided as well. One of the challenges since we launched in November, Starbase in November, is realizing that this is a great challenge on the transportation budgets of some school districts, as well as for lunches and food, feeding the kids. So we've got some things we're going to work on during the summer, and we'll be working with the legislature going forward to find additional funding for school districts to make sure that we're not going to eat up their transportation budget because they're driving an hour back and forth to Little Rock Air Force Base for an entire class. But it's a super event. It's a super opportunity, and put some information in there for any of the teachers that are on here. They may have experienced it already, but if you're a 5th grade program, have a 5th grade classroom, they're eligible. There's a program coming for high school kids as well that the Air Force or all the services are going to be adopting a program to meld them on, to carry that STEM conversation, to operationally STEM, take the STEM learnings in a classroom and actually apply them in real life. Another thing I want to talk about really quickly is higher ed. Higher ed eligibility for in-state tuition. If you are an active duty if you are a uniformed services member, whether you're active duty, guard, or reserve, no matter where you are in the country, and your spouse, or you're a veteran, and any member of your family, no matter where you are in the country, you are eligible for the in-state tuition rate at Arkansas institutions. Certainly this audience here, if you're living in Arkansas, well, you're already eligible. And there is no time limit now anymore for how long you have to be a resident here before you're eligible. But if you're a guardsman in Alaska or a reservist in Indiana, or as a spouse of a reservist in Indiana, you can attend Arkansas Tech University online at the in-state rate. And that's a benefit so that we can find ways to attract efforts that are attract opportunities for recruiting people to come to Arkansas. I want to jump back on Starbase really quick. Right now, the only site is at Little Rock Air Force Base. There is potentially an additional site going into the Fort Smith, Ebbing Air National Guard Base, Chaffee, Fort Chaffee community, as well as in Pine Bluff. So those are the three that we're looking at right now. One right now at Little Rock Air Force Base, but we're funded for 2 classrooms now and looking for a 3rd classroom here shortly from DOD. So that'll allow us to expand out to the River Valley with a Starbase program, especially in light of the expansion of the mission at Ebbing Air National Guard Base, which beginning next year will accept a squadron of Singapore Air Force F-16s in their training center, as well as the Foreign Military Sales F-35 training program. The international training site is in Fort Smith, Arkansas, coming there. The impact of $800 million economic impact in the River Valley. And as a result of that, so much of the school efforts that are being made, as I said, in the Purple Star schools, both at Purple Star districts, a lot of that is centered in the River Valley as they get prepared for that new mission. The last thing I want to talk about is and here I am outside the fence, and as far as outside the government, one of the changes that has occurred with LEARNS Act was the relocation of child care and early childhood education from DHS to Department of Ed. And we're advocating changing that around to make it early childhood education and child care. Because in actuality, what we're seeing is that, especially in workforce development, is that we need to have a 12-month-a-year program, i.e. the child care component, but early childhood education becomes a great opportunity to be able to expand what we're able to provide early years, working pre-K, to be able to advance educational opportunities and adapt a program being tested right now in the charter school model that would allow them to be a 12-month-a-year program that we're looking forward to being able to work with the legislature to develop the funding for that. But basically, the key points here was the Arkansas Military Child School Transition Act. The purpose of that is to facilitate smooth transitions, so effective school transitions. We're taking advantage of the LEARNS Act. We like to call it the Military Child School Transition Act, or the School Choice Act, but in reality, it's a byproduct of some technical bills that all it did was, by changing the language or deleting a sentence in the statute, it opens up the greater opportunity for families to be able to, who may be only here for 3 years and living in an apartment in Maumelle, and making sure that their children are able to go to the school district that best fits what their needs are. And then talking Starbase. And I just offer up an opportunity for answer any questions in chat.
Awesome. Thank you so much. So I know that we did get a couple questions, and I know that Tiffany and Dr. Kindall have gone through and answered them in the chat, but I'm going to ask a couple of them just so we can get the answers aloud for everyone. If a child is not in foster care but is in a situation that is unsafe, or that the parent or caregiver can no longer care for them, can a teacher still be considered a fictive kin?
So the answer is, we use fictive kin for when children are entering in foster care to establish the relationship. Outside, what would happen outside of foster care would not establish fictive kin for us. So we would not necessarily be involved in that situation. That sounds like something more on a private level. that kind of thing, but we use fictive kin to establish the relationship.
Okay, great. And then this was for Dr. Kindall. Is it possible for private school folks to access support through Aware?
Yes, so we offer training. We've already done training at some private schools and charter schools, and yes, absolutely, they can reach out. I have also included the Arkansas Aware website, so you can see what's available without having to request. I think that QR code took you to the request form, but if you just Google Arkansas Aware, it'll take you to our DESE website, and you can see what's currently available. But the answer to that is yes.
Perfect, that's great. Okay, and then this is for Colonel Barry. Says
Hey.
I work at yes.
Sorry, Emmy, really quick. Can I go back to my question? If the person who submitted that wants to have additional conversations with me or someone from the DCFS team, I'm happy to have those conversations just to answer more questions.
Perfect.
It sounds bigger than just the one question is what I'm trying to say. Sorry.
That's no problem. No, and we will share your contact information as well with everyone that attended, like we said, so we can make sure that you guys can get in touch. So this is for Colonel Barry. Says I work at a private school in Fort Smith. The base in Fort Smith has a new mission, and we will have Arizona military families moving to Fort Smith. We are trying to become a Purple Star school so we can be prepared to assist these families. Can you suggest any other programs or steps we might take as a private school to have the support in place when the first wave of families come next year?
Well, I certainly say thank you very much for the efforts they're taking. Both private schools and the public schools are taking a huge load on in the Fort Smith community. I think that the parameters that are set up for the Purple Star School program, there's some criteria there, but it's open-ended. I think there's some great material, and I'll provide some additional beyond what we have in our own Purple Star School guidance. There's some national thoughts that are available that are always adoptable at the local level, whether it's a public school, whether it's a private school or public school. The standard is not the ceiling, and there's some great opportunities that are out there as schools work together to come up with ideas. So I'll put some more information in there from some national efforts that are being undertaken in that realm. But thank you very much for the work out in the River Valley, because it's really critical, and the work's being gone on out there. This is influx. It's not just families coming in we're expecting somewhere in the neighborhood of 200, 300 active duty families, not to mention families from our allied partners that are going to be operating the F-35. So huge amount of work going on in Fort Smith. So you are certainly under our focus, and we need to hear from you often as to what we can do to help.
Great, thank you. So this last question that we're going to take is for Dr. Kindall. It says, will the youth mental health first aid training identify and intervene when a student is experiencing a mental health crisis, be trauma informed and evidence-based, and then will the school resource officers be required to be trained?
Yes, and the answer to that is yes. So the approach used in youth mental health first aid and the adult mental health first aid is trauma informed, and it's a trauma informed practice, and it is a global standardized curriculum. So it is used around the world, and when folks are trained to offer that training, they cannot go off of the curriculum they can't sway from the curriculum at all. So it is peer reviewed and evidence based in nature. Absolutely. As of right now, the SROs and school counselors across the state of Arkansas are required every 4 years to get trained in youth mental health first aid.
Fantastic. Well, we just want to thank you guys so much. We are going to send out an email to all of the attendees, of course, with all of your contact information. We've provided the slides that you all presented in the chat, but those will also be a part of the email. And then there will be a survey as well, to where if your question didn't get answered or didn't get asked, you can submit those, and we will make sure that Tiffany, Betsy, or Don get that, and we can answer that appropriately. So is there anything else that you guys would like to add before we wrap up?
Just thank you. Thank
Thank
you
you
so
very
much.
much.
Great. Thank you, guys. Everybody have a good night.
Thanks, you too.